Friends, I'm consultant urologist at the Kokilaben Hospital, Dr. Sanjay. Nice to be connecting back with you on the subject of andrology, on a subject which we need to take it forward to the next possible level. For a lot of young men who suffer in agony on andrological aspect, which actually plagues and troubles them too much. Let's look into two important aspects which actually can be cured and for which many a times medical management has been opted. So let's get into number one, the disease called Peyronie's disease. Peyronie's disease is a phenomena where a young man in his 30s, 40s, or 50s starts complaining of possibly starting with a pain in the penis. His penile organ has got a discomfort or a pain, more so when he gets an erection. So he wakes up in the morning with a good erection, but possibly a pain, which may have started suddenly, progressively over the last few weeks. And he sees that for the last few weeks to few months, medications don't help him. He has a discomfort and pain in the penis, more so while having an erection. But individuals present with different kinds of pain in the penis, which could be a pain during erection, a pain all the time, or a discomfort, or some kind of a neuralgia which actually makes them very uncomfortable. This is a new onset phenomena in a young man, in a man who is going through trouble and doesn't know what to do. Many a times he sees his family physician, he sees his urologist, he sees colleagues in practice, and perhaps he's taken on a journey of therapy, which helps him to a level, but not completely. So, what all does he go through? He goes through a loss of morale because his erections gradually go down. Some of them maintain good erections. But unfortunately, when they feel their penis, there's a possibility that they would actually be feeling a plaque or a hard nodule or a kind of a mass somewhere in the penis, which was not there. So something new has started in the penis, which is giving them a nodule or a plaque. And when they have an erection, they find a progressive curvature or bend in the penis. The bed is initially acceptable. They're able to perform. The erection does not bother them too much because the erection is still there. By the same time, the bend is progressive. During the acute phase, when there's a lot of discomfort and pain, and they're going through agony of why me and what is happening to me, attempted medicines for pain, there is a progression happening where a plaque or a button is developing in the penis, as a result of which he sees a gradual progression of the curvature of the penis during erection. When there's no erection, he's comfortable. But when there's an erection, he finds the penis is bending. Some of them bend towards him, some of them bend down, some of them bend laterally. So organ is actually going in different direction or a direction from where it's progressing into a bend. The bend can be at the tip, the bend can be in the middle of the shaft, or bend can be completely the root of the penis. So it can be a very severe to a progressive bend, and many of them turn stable and continue to live with bend. They go to their doctors, they attempt therapies, but perhaps various medicines, tablets, oils, and other lotions given to them doesn't work. These patients are suffering from Peyronie's disease. So Peyronie's disease is an agonizing male disease where a fibrotic reaction developing in the tunica albuginea, which is a layer covering the penis, develops into a fibrosis or a plaque or a nodule or a button, as you would say, which actually brings about a bend in the penis because there's a plaque here. And that bend could be in any direction, making him incapable of performance with his partner in the bed, making him quite down and dejected. He's distraught. He knows that he needs a therapy, but that kind of a shame and agony about whom to show and what to do. Some of us as urologists practice andrology. Andrology is that part of urology or the large subset of men's health where sexuality is looked into, their capability in the bed, their capability of performance, their whole inner sexuality, their capability of being a father, etc., is all under the ambit of andrology. So, in this andrological aspect, if a patient comes to me at the Kokilaben Hospital in Mumbai, in India, the aspect of care is to confidence build. Build his confidence, give him a morale boost, and say that this is treatable and curable. Let me tell you that nobody treats Peyronie's disease. We actually treat the effect of the disease. In other words, the bend of the penis is treatable and curable. The erection or the erectile deformity or the erectile dysfunction developing is treatable and curable. The shortening of the penis or the hourglass deformity of the penis is all treatable. So, friends, if somebody in the audience has got a bend in the penis during erection, not able to perform, attempting various medications which are not helping him, continues to have pain and discomfort in the early phase, which later on matures into erectile deformity, or has been losing erections progressively while there is a plaque in the penis or nodule in the penis, or finds a deformity where the penis gets shrunken or gets deformed into an hourglass, or there are multiple nodules palpable and making it quite a grotesque looking non-straight erection, I think it's time to see us. It's time to help you out by treating your disease in terms of treating the deformity. If you have an erectile dysfunction along with a plaque, the basics of the therapy is to keep your erection going, which is gradually going down. So erectile dysfunction needs to be treated, and the effect of the plaque needs to be treated too. But if erections are very good, then what I do is I would actually leave the erections to continue to happen and get better with passing time. We would look at the deformity being corrected. So friends, Peyronie's disease is a male phenomenon. It's an agonizing phenomenon. It is treatable and curable to a point in time where the effects of the disease is treated. So you're not agonized anymore. You're not living in deformity. You're not living with any more agony. Men suffer with this in the prime of their life. And therefore, it is important for us to look at a treatment which could bring them a cure where their deformity is straightened, where the erections are capable, they are boosted, they actually completely come out of the hibernation that they're in terms of shame and agony and why me, why should I get this? And this is completely doable. So friends, if there are friends, if there are colleagues, if there are relatives, and you happen to be ambassadors from this channel, it is important for us to wake people up that this is a male phenomena, quite a hidden phenomena, where there is no bend in the penis when the penis is otherwise flaccid. But when the penis bends around, or the penis has got a great erection, the bend is visible, the blend is palpable, the blend makes you incapable, and you feel so agonized. This is treatable and curable. We treat and cure the aspects that is required to be treated, take you forward to the next and the final level where you find yourself cured and comfortable. The journey is on, the follow-ups are on. We watch you very closely and see that you don't land up in trouble. On the other aspect, very much similar, which I wanted to talk to you is that erections have been treated now for last 25 years with various medications available, which is also available off the counter. You don't have a good erections in your 20s, 30s, 50s. Perhaps you are a diabetic. Perhaps you are a smoker. Perhaps you're taking antihypertensive drugs. All of them actually hammer the penis in terms of the erectile deformity happening. So your erections become poorer. You're not able to perform. And you gradually, with the medications, don't get activated anymore. In other words, the very important organ which has got its blood supply, the nerve supply, and the entire hormones acting in favor as we mature and get to a level from 20s to 50s, we find our erectile dysfunction is refractory. And if you are suffering with refractory erectile dysfunction, that means you've got erections which are not responding to any therapies, which could include the medical management, minimally invasive management, and you have been injected injectable therapies, or the injections don't work, or you not get aroused to a level where you could perform with the partner. You're suffering from refractory erectile dysfunction. It necessarily means that we need to cure you. We need to get your erection back. Others may get old, but you may continue to be young. And for that, one needs to be placing a penile processes. The processes concept is about giving you the anatomy back, the capability back, and your erections are good enough. It obviously does not lengthen the penis. It does not stop your premature ejaculation. It does not improve your libido or desire. All those are parallel therapies which we do as andrologists. But our desire at the Kokilaben Ambani Hospital for people who are suffering with refractory erectile dysfunction, not getting erections at all. It could be a spinal injury. It could be neurological cases. It could be various fractures of the pelvis post-urethroplasty, post-robotic radical prostatectomy. You lose your erections. You probably have also incontinence. These are all treatable today by processes. So we hope all the individuals who watch this as men, who are otherwise capable in all spheres of life and continue to be in agony of the discomfort that they go through, where they have an erection which could be bent as a result of Peyronie's disease, and this erection is not making them capable enough, or the erection is not there at all. And both of them are treatable and curable to a point in time where you do well. So it's important to reach our men, look at them, and as we go forward in helping our men who go through these agonies, which they can't discuss, can't talk to, or they probably meet their family physicians, they probably meet urologists, and many urologists may not be interested in this part of the subject. This subject is very intricate. It deals with a very sensate organ, a sensitive subject itself, and obviously years of expertise into the subject to rise to a level. So friends, if you are suffering from refractory erectile dysfunction and failing medical therapy, if you have no erection and you are a diabetic, you have been a smoker or tobacco chewer, and you have got hypertensive medications also as another hammer which is hitting the entire erectile function. On the other side, you could be a patient with fractures and injuries in your past, happy that you've recovered completely and are back to normal. You underwent a urethroplasty and your erectile function has gone away completely. You are an individual who has got a spinal disease or spinal tumor or spinal trauma, or you've got neurological diseases in the prime of your life. What you deserve is a treatment which will take you forward to the next level. Thank you so much. I am Dr. Sanjay Pandey from the Kokilaben Hospital in Mumbai.